Hello, everyone. It's Dr. Manjiri Nadkarni, Ayurvedic MD, registered holistic nutritionist, and base allergy consultant. Today, I am back for another session of Wellness Wednesday. And today, we are going to talk about a little complex health issue that you could be struggling with, and that is chronic fibromyalgia. So, fibromyalgia is a condition, it's a musculoskeletal condition which is a little bit obscure from a modern perspective, and it is a complex of different symptoms. There is widespread musculoskeletal pain, there is fatigue, there is a lot of tenderness in the muscles, pain on touching the muscles as well as joints throughout the body. And there is no modern treatment for fibromyalgia. There are certain medications that can be given to provide some relief, but it is one of those conditions where the exact cause as well as the exact treatment is very obscure. And that's why I believe that Ayurveda can really, really support your health journey if you are struggling with fibromyalgia. So let's get started by understanding this term. So fibromyalgia is, as I said, a condition where there is characterized by widespread pain. The main hallmark is pain in affected muscles, in ligaments, in tendons, and this pain is often chronic and there is heightened sensitivity to touch. People with fibromyalgia often experience extreme fatigue, which interferes with their daily activity, and this is one of the reasons why there is reduced quality of life. There are also issues, so sleep disorders like insomnia, restless leg syndrome are extremely common with fibromyalgia. Poor sleep is going to further exacerbate the pain, is going to further exacerbate fatigue, and thus it becomes a vicious cycle. Fibromyalgia often comes hand in hand with what's known as the fibro brain or fibro brain fog, where there could be cognitive issues like memory related issues. There is difficulty concentrating. There can be morning stiffness and anxiety as well as depression are two mental health conditions that can go hand in hand with fibromyalgia. Now, when it comes to fibromyalgia, the causes are not exactly known. There are certain factors where you can see there is genetic predisposition to fibromyalgia. It can run in the families. You can also see that there are certain central nervous system abnormalities that have been studied. So there is amplification of pain signals in certain muscles that's seen in fibromyalgia. There can be a history of physical as well as emotional trauma. In my clients, I have often seen a very traumatic, either emotionally traumatic event or a physically traumatic event that will set the condition for fibromyalgia. And often infections, being affected by a certain viral condition can also predispose you to having fibromyalgia. There are also studies done which show that people having fibromyalgia have lower amount of neurotransmitters like serotonin, norepinephrine, as well as dopamine, and these are often out of balance with each other. And these imbalances are going to affect the pain perception. These imbalances affect mood as well as sleep. So, this is where we have to talk a little bit more in depth about fibromyalgia. So, when it comes to diagnosis, there is the American College of Rheumatology, they have established criteria and they look for pain which is widespread, that's lasting a minimum of 3 months, and tenderness in at least 18 of the 11 of the 18 specific tender points. So there are no specific lab tests that are going to confirm fibromyalgia, but rather it can be understood from the pain points, the trigger points that are painful. You have to have at least 11 positive out of the 18. Now, let's talk about the Ayurvedic aspect of fibromyalgia. So, when it comes to understanding fibromyalgia from an Ayurvedic perspective, we have to look at three main things. We have to look at ama, which is digestive toxicity. That digestive toxicity is deeper rooted. So often when we talk about ama formation, we are talking about it at the level of the digestive fire. But here you can understand that the ama is deep rooted and it has gone to the level of mausadhatu or muscle tissue. And that's where you can experience a lot of pain, heaviness, stiffness, tenderness to touch. So ama treatment is one of the things that gives amazing results when it comes to fibromyalgia. Uh, Another thing that I have observed in my clinic, and I can share a case study. So, I had a client who just moved to Canada from Mexico, and her dad was a modern doctor, and she had been struggling with fibromyalgia for at least 5 to 7 years by then. By the time she was diagnosed with it, it was at least 5 years, and she had pain for about 7 years at least. And she could not perform day to day activities, like even walking to the clinic from the parking lot was creating a lot of fatigue for her. What we did was, we went through her extensive diet. We did some elimination of food sensitivities, so that's one thing I always do in my practice. Is initially, if I find that there are certain foods that are affecting you, if you have abnormal reactions to certain foods. And as I say, that food is not supposed to create joint pain, food is not supposed to create digestive distress, right? It's not the nature of the food, but it's the nature of how your system has maladapted, right? So in fibromyalgia, some things that I have commonly experienced in my practice are a sensitivity to nightshades. So things like tomatoes, potatoes, peppers, eggplants can often create a lot more inflammation in people having fibromyalgia as compared to other normal population who do not struggle with any conditions. So that is where we had to identify all the foods she was reacting to. We had to eliminate all the foods, from her diet. And she was planning to go on a vacation, and usually vacations for her used to be very stressful, but that was the one vacation where she could walk for 2 weeks. She walked all over Paris. She was really happy. She was taking pictures, and we have seen that her pain was reduced, and the more active she was, the better she felt, right? So this is something that I want to bring to your attention as well. If you are struggling with fibromyalgia, if you are struggling with chronic fatigue syndrome, these are some key points you need to understand. One is to start eliminating digestive toxicity or ama. And often a lot of this digestive toxicity comes from the wrong foods that you're eating that are working against your body. So we need to identify those, we need to eliminate those, and we need to really put you on protocols that are going to clean up that digestive toxin called ama, right? So often fasting is a really good way, but it has to be a longer kind of a fast. You cannot fast for by skipping one meal. Rather, you may have to fast for at least 24 hours or 48 hours to be able to bring some relief to you, right? So fasting, clearing ama, eliminating food sensitivities are kind of the key concepts here. So once you have done that, then we look at balancing vata, right? There is no perception of pain without vata. So anytime you are experiencing any conditions which are painful, you have to acknowledge the involvement of aggravated vata there, right? And this is where sometimes you cannot fast longer if you are in extreme vata aggravation. So that's where working one on one with an Ayurvedic doctor really can help you, because I can guide you as to how much fasting does work for your body without aggravating vata beyond its capacity, right? So we have to do treatments that are really going to pacify this vata, pacify this wind factor. So your pain perception becomes normal and it's not heightened. And this can be done through various herbs. Some of the herbs that are very useful here, one of them is gugulu, right? So gugulu works really well because it works at the level of muscle tissue as well as it helps balance vata. So we have to do vata balancing here. and we have to clear out a lot of the toxicity from the muscle tissue. So muscle is the third tissue in the line of the seven tissues. So you're seeing that the toxins are a little bit deeper situated, right? So we have to do a lot of what we call deepana as well as pachana therapies, where we are digesting the toxins that are situated at the level of mausadhatu, and that's when somebody is going to find a lot of relief from fibromyalgia. Lifestyle factor wise, one thing that you have to do is you have to incorporate some activity, no matter how much discomfort it is. You don't have to start lifting weights or running, but wherever you are, you can start by walking for 5 to 10 minutes, and the more you increase the movement gradually, the better results you're going to see when it comes to fibromyalgia. The less movement that you do, you are going to be more toxic, your lymphatics are going to be way more clogged, and you are going to struggle with more and more symptoms of fibromyalgia, and the pain is going to be heightened. So this is one of the reasons why you should be able to help with fibromyalgia. So there is a question by Vaishali: how can Matra Basti help with pacifying Vata? Can it help with pacifying Vata without aggravating the already aggravated pitta? So again, depends on what decoction or what oil you're using, especially the oil that you use for Matra Basti. If you pick a oil that is pacifying to Vata without pacifying pitta, so an example is Kshir Badla Tel is Vata as well as Pitta pacifying, right? So you could use that. But here the number one thing is pachana. So you cannot just do a matra basti without really working on digesting, those toxins or ama pachana. So that has to be done first, in my opinion, and then definitely you can work with matra basti, or matra basti is a lower dose of Anuvasan Basti, which is oil enemas, where you're starting out with a really low dose of the oil. So that can be really done. So another thing that I have seen with fibromyalgia patients is that their lifestyle is not regulated, right? So when your diet or when your lifestyle is not regulated, when you are sleeping at random times because of the pain, you are struggling with insomnia. um, so you could be not sleeping at regular times because of the pain. Your diet appetite may be reduced, so you're not eating at regular times, but these are factors that are going to further aggravate vata. So from a lifestyle perspective, the more you try to regulate your timings, whether it's your bedtime, whether it's your meal times, that is going to be extremely beneficial for you, because that's really going to normalize the secretion of your neurotransmitters as well as different hormones and things like melatonin, which are also connected with other factors in the other neurotransmitters in the body, right? So when you regulate your melatonin, that's also going to have a healing effect on the body. That's also going to help you regulate your dopamine and other neurotransmitters eventually. So making sure that you are regulating all your timings, right? And drinking warm water is another key. So when we talk about Deepana Pachana, one simple strategy that I tell most my clients to do is, drink warm water and add a little bit of dried ginger or shunthi to it, right? So adding, like drinking a glass of ginger water, very small amounts of dried ginger. You can add a pinch or two pinches if you don't want to aggravate the vata. So that's really going to help digest that toxins located at a deeper level. And this is extremely basic. This is something anybody can do at their home, and this is pretty safe. So this is a good way to get started, is start doing amapachana. You have to identify what foods you are reacting to. Are those nightshades? Sometimes gluten is a common factor as well. Sometimes dairy can be it. I've seen some of the weirdest foods people react to, like avocados. Some people have a stronger reaction to avocados as well. So finding the foods that are not working for your body is crucial here. and making sure you're doing amapachana, you're clearing the digestive tract of all the toxins, whether fasting, whether using ginger water, is going to be really beneficial. And try to regulate your timings as much as possible. And then we can do therapies, like different Ayurvedic therapies like basti treatment eventually, when we have cleared the digestive tract a little bit, right? So if you have any questions, please let me know. And if you are interested in working one on one to help heal from your chronic fibromyalgia, just book a 15-minute free appointment by clicking the link here. And you can always message me, and I'll be more than happy to help you uh, heal from fibromyalgia. So Wendy is saying this is perfect timing for me. I'm in fibro flare today and feeling dehydrated and foggy. Yeah, so drink plenty of water and drink lots of warm water. Warm water is very detoxifying to the body. It's ama clearing, and as I said, adding a pinch of ginger is really going to support you. And once your body feels better, then you will eventually feel clearer in your mind as well, right? So Vaishali is asking, by what time must one fall asleep maximum to keep ourselves healthy if it's not possible to sleep quite early? Right? So I would say, especially if you are living in Canada, it starts getting dark at around 6 p.m. right now. So 10 would be an ideal situation where you can go to bed. So my bedtimes are usually regulated to 10 p.m., and I try to wake up by 4:35, because I'm usually an early morning person, right? So 10 is a decent time. Even in India, I think when you are sleeping at a really later time, right? So if you are staying awake past midnight, or if you're having your dinner, which I've seen some, often people in India, they'll have dinner extremely late by 9:30, 10, and then the sleep times are around midnight or 1 o'clock, right? So that is going to create more stress in the body. When it starts getting darker, right, your body will start increasing the secretion of melatonin, which is going to slow your digestive tract. So at night time, when you are eating food, you are not going to digest it as well as when you had the same amount of food, the same quality, quantity of food in afternoon or at a time where the sun is more active, right? So when it is darker, your body is going to struggle to digest food. The body processes are going to slow down. The digestion is going to slow down. So ideally, try to be in bed by 10. And if you are saying that, oh, I can't really, go to bed this early, then another suggestion I would make is try to keep a gap of minimum 3 hours, 4 hours if you can, between your dinner and your bedtime. So there should not be food sitting in your stomach, digesting, and then you're asleep, right? So that is one way to create ama, to create digestive toxicity. Because when you sleep, your body processes are further going to slow down, right? So if you are sleeping on a full stomach, if you are napping on a full stomach, right, that is going to create ama, that ensures that you're not digesting the food, you're not breaking the food down. The food complexes that are undigested, right, are going to trigger more pain in your body. So making sure that at least a 3 to 4 hour gap between your meal time and your bedtime is good. The latest to go to bed would be 11. I would not stay up past midnight. And there are studies done that, every hour, even if you sleep extra in the morning, you cannot compensate because it's not the same quality of sleep. So every hour you're losing past midnight, there is no way you're going to get that back, right? Because your body responds to the diurnal rhythms, the rhythm of the sun, right? When there is sunset, there is darkness outside, that will increase the melatonin. The melatonin is going to slow down your digestive processes. So you are not going to digest food the same way, right? And even if you stay asleep till 10 o'clock in the morning, you're not compensating for the sleep that you would have had before midnight, right? So these are some simple things to regulate um, for managing your vata, and also for managing ama, right? The best way, prevention is the best cure. So the best way to deal with ama is not let it get formed in your body, right? The best way to avoid this ama formation is to really strengthen your digestion. And digestion strengthening does not just come from taking digestive supplements or trikatu or enzymes. It also comes from very basic factors, like you're paying attention to food, you're chewing the food, your body is prepared to eat, you're not multitasking, you're not working on the computer and grabbing a bite, right? So these are all recipes of creating ama, creating toxicity. So simple things like paying attention to food, making sure you're taking putting one hand on the chest, one hand on the belly, close your eyes, deep breathe. That puts your body into the rest digest mode, and then you start eating. And then that will ensure that whatever you're eating is not forming ama, it's not forming toxicity, it's getting digested well, and it's actually nourishing your body. So Wendy says, if I ate some chips and fries, I think maybe, are you trying to say about fries at 9 p.m. at slept and it would that cause, it can, oranges, yeah. So I would not eat chips which are heavier to digest, right? They may not seem like a lot to digest because, oh, it's just some chips, they don't stay, they don't keep me full. But at the same time, they are very oily, right? So they are not going to get digested that well. So, especially having chips with orange, like we're also looking at not the best food combination there. So, when we try to eat earlier, like at least 7 p.m., if you're going to sleep at 10 o'clock, I would not snack late at night. I would not snack post dinner, especially if you're having a flare up, right? So, definitely it can cause it. There are multiple factors, sometimes stress is also another factor, your emotions, how they are, that could be another factor for fibro flare up. But definitely if you are eating chips with oranges, that itself is a bad combination. You're eating later at night and then you're sleeping while the food is digesting in, that will create more of the digestive toxicity, and that can contribute to fibro flare up, right? So keep a dietary diary, try to figure out everything that you're reacting to. And if you want to get tested for foods, just reach out, and I'll be more than happy to help you, right? I'll be more than happy to help you figure out what are some foods you're reacting to, and we can try eliminating those, and we can try regulating everything else to make sure you're not in that fibro flare up anymore. Okay, so if you found this information useful, please share it with somebody that you know that struggles with fibromyalgia. And if any of your friend is looking for a solution from fibromyalgia, please share this video, and I hope that they'll find this helpful as well. So thank you for watching. I'll be back next Wednesday with another session on Wellness Wednesday. Till then, stay healthy and stay happy, and I will see you soon. Bye for now.